ACL injuries are dreaded among athletes and sports fans alike. The Cowboys and the Browns have already lost players this season because of it. But professional athletes aren't the only ones at risk. Dr. Bryson Lesniak, an orthopedic surgeon at UPMC Sports Medicine, is here to share more about the injury. And you don't think about it because you know you're watching sports, but this is common for the everyday person. How common is it?
Yeah, it's really common. So in the United States, 100,000 ACL reconstructions are performed every year, roughly. Here at UPMC in our health system, we do well over 1,000 a year. And so we have a lot of professional sports teams, obviously, and college teams here, but that doesn't add up. So it happens to everybody from, you know, young kids, 10, 11 years old, all the way up to people in their 60s.
Yeah, it happened to my husband in college. He played basketball and he tore both of them.
Both.
So what kind of activities can lead to this?
Yeah, so competitive sports, athletics, anything that involves kind of quick stop-start movements. So for the professional athlete, those moves are obvious. In our daily lives, things that we don't often think of but can be pretty common are, you know, skiing. Skiing's a large proportion of ACL injuries. In recreational athletes, tends to be soccer, especially females. You know, for every man that tears their ACL playing soccer, or a boy, 6 to 7 girls will do it doing the same sport, in this case soccer.
Wow.
Yeah.
And this is interesting because my husband didn't know that he popped out, that he tore his ACL when he first did it, but the second time he knew. When do you seek medical attention? Yeah,
usually the first time you tear your ACL, there's a lot of swelling just because there's blood in the joint from the injury. So usually the first time you'll know, but every once in a while, I just saw someone last week where there wasn't a big swelling response. And so really what happens with the ACL is first couple of days there's pain, but the pain can go away fairly quickly, especially if there's not swelling. The issue is, does the knee give out on you? Does it, when you start, when you get out of when you step down off a curb, when you get out of a short chair like this, or getting out of a car, and you plant and twist at the same time, if your knee buckles on you or gives way, that's a telltale sign that the ACL might be injured.
And what kind of treatment is there for this?
Yeah, most of the time, in this country anyway, most of the time, about 90% of the time, people have surgery to reconstruct it. So you can't kind of tie the ACL back together, although people are trying to do that. You have to reconstruct it with tissue from someone else or somewhere else in your own body. And so that's what you have to do to surgically manage it. There are some people that can get away with not having their ACL reconstructed and live life without it if you don't play sports, if you don't do agility things.
Okay, so is this different than tearing another knee ligament?
Yeah, I mean, every ligament in the knee has its own unique kind of behavior pattern because they do different roles. The ACL in general is the most common one that gets operated on because it doesn't heal very well on its own. The other ligaments can often heal on their own, especially like the MCL, which is, if you watch college football or professional football, you hear about a lot. It's a really commonly injured knee ligament, but that often heals on its own. The ACL doesn't heal well, so it's its own kind of animal.
And what is the recovery after surgery? I've heard that it was very bad. Every time I ask my husband, he's like, no, it was the worst thing ever.
Yeah, it's a lot. It's a lot. I tell everybody that this is a marathon, not a sprint when you tear your ACL and have reconstruction. You're usually in a brace or on crutches for several weeks. Some people do as long as 6 weeks on crutches. Jogging right around 3 months or so. Sports, you know, we used to try to get people back 6 months or earlier, but now we know that if we wait a little bit longer, 6 to 9 months, you have a much lower chance of happening again. And so it can be up to a 9-month recovery process.
Yeah, so he said it was 8 months, but he also was talking about like the different techniques they would have to do in like therapy when he would go for that. Explain that, like what's the process? Because it sounds painful.
Yeah, well, it's a multi-step process because you want to accomplish different things in different time frames.
Okay.
Some of it is you need time for the ACL to become an ACL again, just to heal. And then some of it is you need to get your leg strength back and your total body strength back because you're immobilized for a while. You're not doing as much. And so there's a process. You start with range of motion, and that's the really uncomfortable stuff at first because the knee's swollen and stiff from surgery. And then you get to strengthening. And then once you're strong enough, then you start doing functional things that you want to get back to doing, like skiing or basketball or soccer.
So how can people avoid this?
The best way to avoid it is to kind of stay in as good a functional shape as you can. Now, sometimes, no matter what you do, it's bad luck. Some people have different anatomy that they're more prone to tearing ACLs. Some people you get contact injury. But the best thing you can do is core strengthening, leg strengthening, and kind of there are ACL prevention programs out there. We use it more for people that have torn and don't want to tear again, but you can find it online and do it as a preventative. And a lot of our local sports teams, college, professional, et cetera, all do ACL prevention programs to try to minimize that risk.
Very nice. Thank you so much for joining today.